All right, guys. Oh my goodness. It's Friday night in Cool Springs, and I'm here with Dr. Justin Deering, and it's our 7th Hashimoto's Christmas party. Hard to believe. And you guys can't see because they're all a bunch of chickens. There's a whole house full of people in here tonight. And if you didn't make it here, you are missing an entire smorgasbord buffet of gluten-free food over here. I'm telling you, better than any restaurant that's out there. So anyway, yeah. Well, happy holidays, Merry Christmas, Hanukkah, what else is there? Kwanzaa. Yes, happy Kwanzaa? Merry Kwanzaa? I don't know what it is, but I have got Dr. Justin Deering in here tonight. He is a functional neurology chiropractor. Right. Something similar to that, right? Yes. Deering Chiropractic. Now I want to tell you, yes, as you guys get logged on, hit your heart buttons, hit your like buttons and all that good stuff. Let me tell you something. I have never had vertigo a day in my life, ever. 52 years old, no vertigo. Never had anything wrong with my head and neck that's like clinical, something wrong with it. And I woke up in the middle of the night about 2 months ago, a little over 2 months ago, rolled over on a Saturday night, and it was like the whole ceiling was spinning. And I went like that for about a week. And a friend of mine, Angie Ryle, said, I have one person you need to go see. She said, it's Justin Deering. I said, well, what? Tell me about him. And she said, there's only one person I would see. And I'm going to tell you something. And I had to fly to Vermont with vertigo. And I found a chiropractor at the conference in Vermont, and he worked on me there, but it still did not go away. And after one visit with this man right here, my vertigo was about 90% gone, about 90. Wasn't 100% until last week. And then 100% gone. I can do anything you want with my head, my neck. I mean, it's gone. It's unbelievable. So I want you to tell us what you do, okay, how you do it. I'm so glad you're here. Thank you for taking time out on a Friday night.
Thank you for inviting me. I appreciate this opportunity, and the food's delicious. So let's discuss this. So what we do in functional neurology is to assess complex scenarios. So somebody who experiences an injury to their brain has a clear-cut problem. You know, we can define it. We can say that this is the injury, and you're having headaches or you're having foggy thinking because of the injury, and your brain has a bruise on it, for lack of better definition. But in the case of vertigo, in that particular scenario, vertigo is quite complex because the inner ear is very complex. It connects to almost everything. It connects to your cerebral cortex in your brain, and it connects to your eyes, certainly, to keep your eyes stable when you're walking or moving or spinning on a merry-go-round. So the vestibular system can be either in a vertigo type situation, like yours was, with a real spinning room, and that is typically part of an actual inner ear problem. So the inner ear sends messages to the brainstem, and it becomes skewed, and the whole room starts spinning, and you get nauseous and sick because of that neurological reaction. And if it continues like that, and you have repeated episodes that aren't typically involved with one head position or another head position. In your case, you came to me and said that you were turning around to your desk, and your front desk manager, and you were just walking, and you didn't have the vertigo spinning, but you had significant dizziness, like you were going to fall. Or and so that's a presentation that says that it's not just an inner ear problem. It is also a nerve problem inside of the brainstem that becomes fatigued. For instance, right? Somebody was telling me about a head injury that they had a moment ago, and that they've had multiple maybe, and the symptoms accumulate over time, and maybe that third or fourth little whack on the head, on the cabinet, gives the person their most significant symptoms that make them seek out some sort of help. And so typically in the medical world, the management is medication or some other type of therapy, and usually those can help a person survive until it goes away. But in the scenario like yours, it was very complex, and so to diagnose and say where is the problem coming from is really our specialty, and where we're skilled at seeing those things and trying to apply interventions everybody's different. So we have to kind of understand exactly what the mechanism is and try this and try that and try a little bit of this and a little bit of that and see what's going to work. So we tried some eye movements, we tried some head movements, we tried a few balance techniques.
You wouldn't believe the stuff. He has like a whole lab. Sabine, you've been over there. Has anybody else been to his office? Yeah, Teresa. Like a whole lab of crazy, like you don't know what's going to be behind each door. It's unbelievable. And you're wearing these huge, like these big things on your head. You look like some sort of Frankenstein thing. I mean, seriously.
Yeah.
And these things flying at you and you're trying to look at, I mean, it's unbelievable. It really is. It's fascinating.
We have lots of assessment tools that we use to get biomarkers, we refer to them as. And it helps us to understand all of the things that are going on in the brain. Eye function tells us about a lot in the brain and pathways of the brain itself, the vestibular system, and balance mechanisms. You know, all of us have a vestibular system and a neck and an inner ear and eyes, and all of those things come together to integrate. And we have to measure every single aspect of it. So we measure your balance, put you on a foam pad, and see the direction and the amount of sway, and it helps us to understand, you know, how big is the problem, how much how much of the system is affected through balance or through other systems like heart rate variability. We measure to see how the autonomic nervous system is responding to the stressors. You know, are you stressed so much so that you're going to fatigue and fail? So in a thyroid community generally, you'll all probably experience some level of fatigue and failure of your autonomic nervous system, because the thyroid is certainly the main end target of the autonomic nervous system to maintain metabolism and to maintain the energy to move or to do anything. And so the big controller of that is the pituitary, but it's under the control of the hypothalamus, which is all located in and around the brainstem and subcortical structures. And there are lots of influences from below, from the body, metabolism, movement, and balance. And then there are a lot of influences from the cortex and your emotional systems and fear and anxiety and all of those things play a big role in affecting that autonomic nervous system. So we measure it all, and we use all those fancy gadgets to do that. So it's a lot of fun.
It's fascinating. He has a lot of brain injury people, migraine headaches. I have a lot of patients with migraines, and I've heard amazing things about you with migraine.
Yeah. Migraine is also a neurological phenomenon, if you might call it that. In the medical world, it is again treated with medications and other things, with a lot of times with success. You know, if you have a migraine, take an abortive medication and it kind of knocks everything out, and you got to go to sleep and you wake up and everything's cool. But who has the time for that? So it is a way for us to also look at all of those same systems and say, where's the stressor coming from, to diagnose where in that system the migraine is coming from, and figure out ways to strengthen the weaker areas or diminish or dampen down the areas that are firing too much, that ultimately lead to that fatigue that then ends in a migraine. So migraine comes from fatigue of those neurons, and they essentially kind of die and spill out some of their excitatory things that are within the cells to other areas, and that affects nerves in the brainstem that also gives sensation to the head. Very much like a disc bulge in the low back gives you radiating nerve pain because there's physical pressure on the nerve. This is sort of a chemical stress that affects the trigeminal nerve, which gives you sensation of the head and the face. And migraines present in all sorts of different ways, but most of the time, migraines have a significant stressor that's coming from the neck. So oftentimes we can just fix the neck very specifically, and it changes. But then also oftentimes we have to change the metabolic system, which you are very well aware of. But it's a combination of all things, and that's how it works.
That's unbelievable. What's your favorite thing to do? What do you love? What do you love? Do you have one certain thing? Because I love thyroid.
I do. I mean, I kind of.
And it takes 1 to 2 million pigs a day to be killed to make enough thyroid medicine in the United States. Did y'all know that? You all that were, many of you weren't here last month. Yeah, 1 to 2 million pigs a day are slaughtered for your thyroid medicine.
But they're probably slaughtered for their meat
Well, they're eating those too, but it takes 1 to 2 million pigs. That's a lot of pigs. No, it takes, no, there are no organic pigs. There's no organic thyroid medicine. Huh? No. No, they're not organic. You can't grow enough pigs to organically. We don't need to get into all that. We're here to talk about.
I'd like to know that.
No, they're not organic pigs, and it takes 6 to 8 months to grow a pig big enough to get their thyroid to do. I mean, it's really quite fascinating. It's way more than here's your bottle, here's your WP. I mean, all those pigs that are slaughtered every day, and they're putting and those little thyroids. It takes a lot of thyroids. Huh?
You don't really want to go there.
Oh yeah, no, we don't want to go there. So anyway, okay. What do you love? Is there anything that you just love?
There really is. The brain injury, folks have a concussion that they can't recover from. We get people, oftentimes, we're always a last resort, naturally.
Yeah, I know that
and
feeling.
So it's kind of good because
Always
they've done
the
everything
last.
else and they've ruled everything out and there's no tumor sitting anywhere. And, that's not the reason that they can't look to the right at all, or it's not the reason that they can't stand up and walk and their balance is off. So we kind of get them pre-diagnosed and they've gone through all the process most of the time. But we get to see them and they're injured and they can't recover. And whether it's, foggy brain or extra emotionality because they can't inhibit their emotions because their frontal lobe doesn't work so well. Or if it's simply, I can't get blood flow to my head when I stand up from this chair, and that's been happening for 8 months, or whatever the case is. We've seen people that come from concussion scenarios where they've gone through lots of therapy and they've had some gains and some improvements in certain ways, and they just can't get these 2 or 3 things back, but they've gotten 5 things back. So we just help that person along the rest of the way, and it really fulfills them. But we also get the ones where they've had no improvement. And everything's wrong. You have to sift through all of it and find what's the biggest problem, what's the underlying cause. And those are difficult, but they're also fun, so they're challenging, and it's like a puzzle to me. So we go and we try to find it, and to take the most recent example, the really thing that makes you tear up. It's a young nurse. She's younger than me. She couldn't work. She lost all of her ability to think and to move and to drive, and her parents are driving her. She goes to work with her mom, luckily, because her mom is a nurse in the same building. So for 8 months, she couldn't work. It's just she was reduced to 3 days a week, working 3 hours a day. Couldn't. She was pushing carts, and she's an RN. So anyway, she came in. These are the symptoms. This is what's going on. Biggest thing is, I can't think. And when I try to think too much, I crash. And so I go home and I can't, wake up the next day because I got a big migraine or whatever the case is, because everything's fatigued.
Sure.
And so first we begin that scenario with a hunt to try to figure out what's going on. And we implement intensive therapies in those scenarios. We're treating 2, 3, 4 hours a day, and get that person, in every day. And by the end of the week, we've made some gains or made a lot of gains. They're feeling better. They couldn't follow commands the first day, and we just do a few little things that are kind of reflexive, things that their body would do anyway, that they can't really think about. They don't have to think about. And then we build it from there. Little reflexes, then bring in some complex things for them to coordinate and to do. And once the nerves get the ability to do it, or they're introduced to it again, and they can handle all of it in a graded fashion, then they start to improve and they start to grow and they start to become stronger. And 3 weeks down the road, they're working fourth day for 4 hours or 5 hours, feeling pretty good. And a month down the road, we've leveled off therapies, not treating so much, and they're working 5 days a week at a limited capacity. And I just saw this girl yesterday, and she's sits down and looks at me. She's got full affect on her face, and she's just like, "Hey, how's it going?" "Yeah, still doing great. It's good. Worked all week. Worked 5 days this week, and all day long. And now I'm teaching the other people this new system that we've had to learn in the past month.
Wow.
Since she had her major gains. So to see it turn around like that is, really fulfilling. just something that's cool.
What led up to that
Yeah.
crash?
Well, the crash was most likely, and it gets complex, but in females specifically, when they have a head injury or multiple head injuries, during a time of the cycle where estrogen is really, really low,
Yep.
those have the largest incidence of nerve damage all through the brain, because estrogen is a major protector of all neurons and nerves, and studies on
Estrogen
Alzheimer's
has
and
over
all sorts of
400
things.
functions in your body, over 400.
And
And it is so protective,
Yeah,
brain
absolutely.
protective, for sure, with dementia and Alzheimer's.
absolutely.
You bet.
And so the reason, for the same reasons that it happens in dementia and Alzheimer's, to be protective, it's also protected for injury. So recovery or protection of the cellular function, of the ability to produce energy and to communicate with the cell or the tissue or the nerve that leads to the thing that controls it. This particular person was, injured right away, and she couldn't recover. And so just like, say in females, a terrible, terrible menstrual cycle is kind of like, a bad hangover. And so she described her symptoms as, I feel like I've had a hangover for a really long time.
Wow.
And I just can't think, and I can't move, and every day I wake up and it's the same thing. And nothing ever makes it better or worse, or other than working or thinking, makes it worse,
Makes it worse, yeah.
Yeah, so that's pretty much how it got that way. I just couldn't get back off the ground. The networks, the brain's a big network for me to move my right hand. My left brain has to fire up the network to be able to know where my hand is in space. And if I want to go grab this bottle without looking at it, my networks have to be working really well. And they have to be sort of patterned over time. And she just lost her pattern, and the pattern never reintegrated with the rest of the system.
Am I correct? Do I remember this right? Like, the football players are not your number one concussion people. It's teenage girl soccer players. Am I right?
That is correct.
Yeah, I learned that last year in New York City at a conference. Dr. Rob Silverman was talking. He's a chiropractor, actually. And he taught us that teenage girls are the number one. And it completely messes up their hormone system when they get their progesterone levels, everything, when they get hit in the head.
Think about the hypothalamus.
You bet. Well, that's
That's the
it.
exact
That's what
reason.
it, that's the whole reason, is because of that.
Ball causes that damage?
You bet.
There's a twisting that happens in the brain and the spinal cord, essentially. Every whiplash that you've ever had, or every time you've fallen and kind of whacked your head a little bit, but you wake up and you're not starry-eyed or anything, you're kind of cool, maybe you have a headache or something. But every time that happens, you can be sure that the brain stem is stretched, because the skull shears one way or the other, or rotates, or a combination of all of those things. And there can be major injury or just minor injury that you recover from. And the folks that we end up seeing as their last resort are the folks who had a major one and couldn't recover from it.
You need to talk to soccer moms.
Well,
Yeah, you do. Yeah.
we couldn't handle them all. Right?
Yeah.
And mouthpieces aren't required in soccer.
No, they're not.
I didn't know that either.
Wear helmets.
Well, I'm telling you, the stuff he does, he was talking about how you have to be firing here for this to work. The things he makes you do are unbelievable in there, and following all of this, this, that, and other, and he gives you all these exercises. So I'm on the airplane, I don't know where I went. It wasn't Vermont, but I was on the airplane somewhere, and I was going up and down, sideways. And I took a yoga class just to see if I could stand up in yoga. And so during yoga, we're standing, I'm doing all these exercises. I look like a total idiot,
Cool.
but it worked.
Right.
I mean, it works. But he has you doing these things to where you're touching your nose and you're tapping all this. And I'm telling you, I think I can do it all now, but it was very difficult. And he was so kind, because I would miss it. I mean, and it's so frustrating. And then he'd say, count back by nines from 100. What? I can't do that on a good day, much less when my head is spinning. Or he'd go by sevens, and then he'd say, oh, everybody has a hard time with that. And I was like, yeah, right. No, I mean, here I am writing prescriptions. I can't count backwards, and yeah, it was terrible. But it's interesting. It's so amazing how that brain fires, and every neuron, and when they're off in there, And that's what he does, is get you back together. I'm impressed. I'm highly impressed.
Well, that's a wonderful
Can
thing.
you do a demonstration?
No,
Of course not. She's
No.
fixed. We don't want to break it.
no.
Stand on one foot
Uh-huh.
and do this thing.
I wouldn't want to embarrass anybody.
Well,
Yeah.
sure.
It's her. It's Dani. She
I
doesn't
could
get
embarrass
embarrassed.
myself, right?
Yeah. But I'm telling you, really, and he's not a huge snap, crackle, popper, but he does. He does. And so I want you to tell us about Chinese medicine, because he practices Chinese medicine as well. This is not just chiropractic he's doing over here. He does acupuncture, because I was at the gym and was lifting weights because I couldn't do anything much because I was afraid I'd fall. I thought, oh, I can lift. Well, anyway, I somehow hurt my left arm over here. But boom, he's fixing my head. He's got needles in my arm before I know what's going on. Needles coming out of my ears. They're all over the place, right?
Yep,
So,
yep.
and practices herbal medicine.
Sure,
So
sure,
talk to us
sure.
about Chinese medicine. I love Chinese medicine.
Me too. So, yeah, historically, it's been used for a long time. So somebody knew what they were doing, and it works to a degree if you know what you're doing. Sometimes I don't, but we try and we work hard to figure out what's going to be the best thing. And so oftentimes we're using acupuncture because it's a stimulus. It's a gentle stimulus for the brain. So, we think about it in neurological terms more so in practice, in my particular practice, more so than in Chinese medicine. But I love the concepts of Chinese medicine and the different constitutional aspects of Chinese medicine, which are great, but I don't have time to think that hard. And so we apply it in a neurological capacity, so that when I place a needle in a end structure further away from the nervous system, like the hand, the hand has a very large representation on the maps of the brain on the other side. And so when I place a needle, we know that there's going to be a certain level of activity. If it hurts, there's going to be a little more activity. If it's just a muscle that grabs it, it's going to be a moderate amount of activity. And so we want to drive that activity in these particular networks. And so we use the hand here for your elbow. We use points on the wrist. We use points on the elbow itself, points on the neck that help all of that system to integrate a little bit better, so that maybe there's more blood flow that comes to that area the next time you go to use it, and it sort of washes away the junk that built up from the injury or the strain. And we use the ears, a lot, because they're just really cool. There's lots of cranial nerves that come from the brainstem, and they have their sensory endings. Almost all of them have a sensory ending below cranial nerve 4. All of them have a sensory ending on the ear, somewhere on the ear. So there's little maps of different places where a trigeminal nerve comes out, or the cranial nerve 10, the vagus nerve that goes to the gut and all the organ systems. And so you can influence a whole range of things using those practices and those tools. Scalp acupuncture is very good for neurological conditions, and so we stimulate the scalp in a way that's similar to an EEG if you measure the scalp. There's been a long practice of that anyway, and it seems to have a good correlation. So we just assume that the practice is accurate and true, and it never hurts. So we always
Seems to work.
always try to use acupuncture in a gentle way.
Yeah.
And then herbs and Chinese medicine, those concepts.
And you've got the
gentle
Chinese
thing.
lamp too.
Yeah, we use the heat lamp.
Yeah, the heat lamp.
Yeah.
If you have the tendency, sometimes I have the tendency to have upper respiratory stuff in the winter.
Mhm.
And, I find that the Chinese approach really helps between the needles and the moxa sticks and the Chinese lamp.
Yeah, it's really, really beneficial. And the reason that is because there's this big theory on how much infrared radiation is created by that little lamp and all the minerals in it. But regardless, it's giving heat to the skin and penetrating into the skin, which is kind of warming and relaxing for the calm side of the nervous system, which is the parasympathetic nervous system. Oftentimes we put it over the abdomen for migraines, and then needle certain spots, and it's multiple stimuli coming in very, very gently and helping the system kind of recover in a way that's beneficial without doing too much, but doing just enough. And so that's one really good thing.
Why do you put the heat over the abdomen for migraines?
Because of the vagus nerve and the vagal afferents that come to the brainstem, and they travel up to the brainstem, and they land in the medulla and the the areas that are involved with not only digestion, motility, and secretions for gastric enzymes and things that we use to break down food. But they also give a level of stimulation to the lungs and the liver, and so by putting it on the abdomen, where there's the most of that vagal afferentation coming from, it seems to help the system be relaxed enough to recover. And so oftentimes, if the person's in a stressed state, they can't handle any more stimulants. And so if you go in and shine a light in their eyes, it's going to make it worse. Whatever you do, so we have to do something that's gentle enough to get in there and say, hey, calm down. And that's why we put it over the abdomen, and it seems to have a better effect than putting it anywhere else. But there's all sorts of theories on what that means constitutionally and everything else. But it helps to calm the brainstem. That's it.
Well, I'm telling you, he's all. So somebody just asked it, is this the vertigo whisperer you were talking about, Dani? This is Donna West who said that. She's been struggling with it. So yes, Donna, this is the vertigo whisperer. There you go. Well, I'm telling you, I mean, anybody who fixes something that's going on with me, I'm a big believer in. But we're gonna sign off on here live. What is your phone number, and how can they get in touch with you?
The office is Deering Chiropractic Neurology. You can Google us. Phone number is 615-721-5141. And we are just down the road here from Nashville Restorative Dentistry. We are just south of Moore's Lane on Liberty Place, or off of Liberty Place, and that's Isabella Lane in Brentwood.
Yeah, is it technically Brentwood? I guess
it's on the Brentwood and Franklin line in Cool Springs.
Well, I'm going to tell you, you won't be sorry if you give him a call, because I'm so impressed. And do not be in a hurry. Now, this is the thing, because my first appointment was 2 hours, maybe even more. I don't know. I mean, I walked out of there. So, but I had everything on. I was standing on things, head lit up in 42 directions, and blood coming out of my ears well, you know what I mean. He had stuff all over me. I had mascara down my eyes because I was on my face, and he's got, he had acupuncture needle. Yeah, I looked like I'd been beat up, but I had not been. It was a wonderful 2 hours, but I mean, good Lord, I walked out of there and I was like, what the heck just happened to me? But it was unbelievable. So don't be in a hurry. Don't do this on your lunch break. If you got a 30-minute lunch break, you're gonna be in deep trouble because he covers it all. I mean, so thank you. We're gonna talk here. But we're gonna sign off, guys. Listen, those of you that are on here, January the 11th is our next meeting, and we have a guest speaker, Dr. Leslie Cuevas, rheumatologist, functional medicine, rheumatology. She reached out to me and said, I'm opening my own practice in January in here. She's at St. Thomas, or she's somewhere now in Nashville. And I hear that you are good at functional medicine. And so anyway, I have sent 3 patients to her so far this week. And she just called me this afternoon, and boy, she's the real deal. So she's going to be speaking on autoimmune disease, rheumatology, fibromyalgia, lupus, rheumatoid arthritis, multiple sclerosis, all the things autoimmune. And multiple sclerosis is neurology, but I mean, all the things that are rheumatology, autoimmune. And so I'm excited. At 6:30 here, January the 11th. Yeah, I'm really excited. Her practice will be open here at Williamson Medical Center in January. Cool. Yeah, it's exciting. Yeah. So it's really exciting. All right, guys, have a great one. Have a great Christmas. We'll talk to you later. If you missed it, you missed it, because it is, we're getting ready to eat and have some gluten-free banana pudding too that Janetta brought. I've been sitting here waiting to eat it. So, all right. Thank you, Justin. Appreciate it. I will put his phone number up here, and you guys can give them a buzz. All right. Tell them Dani sent you.